Hey everyone, Dr. Ty Hall here with East Valley Chiropractic coming at you. Wanted to jump on today here for kind of our weekly video that we've been doing and talk a little bit about a common condition that we see here, and that's sciatica. So today I'm going to discuss what it is, how you get it, and then obviously what we can do to help. So sciatic is very, very common here in the United States. It's reported that there's usually about 3 million or more cases in the United States per year that this can happen. But typically what sciatica is, many of you have probably heard of it, but it's an irritation to the sciatic nerve. Obviously, a lot of times when you have this, it can be a pain that's typically sharp or radiating, and it can vary in terms of its degrees of its intensity. But it'll originate from the sciatic nerve, which starts in the lower lumbar spine, and then it'll form and it goes actually down through your glute all the way down to your leg. Oftentimes when you feel this, you can feel it in your back or in your lumbar spine. You can feel it in your glutes or your buttocks, your hips, and then either one or both of the legs down into the extremity, into the feet. Like I said, a lot of times this can be felt as like a sharp pain or radiating pain, or almost like pins and needles. So that's what sciatica is, and how do you get it, or how it gets irritated is a number of things. It can be caused from a disc herniation, which is usually from an injury. So the disc will bulge out and hit parts of those nerve roots that form the sciatic nerve. You can also have a bone spur from significant degeneration within the spine. This is stuff that usually will build over years and years and years of wear and tear on the spine that will cause those bone spurs to form and to impinge upon that nerve. Another common one is, and I'm going to use my spine model here, is from irritation to the piriformis muscle. Now, the piriformis muscle, it's a muscle that's in your back here, and it originates on the front part of your sacrum, which is this bone here. So it originates here, and then it'll actually go over to, this is where your femur connects. So it actually connects from your sacrum here over to your femur. And it's a muscle, like I said, that it sits right in your glute. And when that oftentimes gets irritated or tight, the sciatic nerve actually passes underneath that muscle. So if that muscle, you can imagine, is tight, it's going to compress upon that nerve and cause pain. Now, there's actually a small percentage of people who that nerve, the sciatic nerve, actually pierces through the piriformis. Very small percentage of people, but it does happen. And then the last and most common way that it gets irritated is from spinal dysfunction or a breakdown in mechanics. And that's the most common that we see here, is obviously if that lumbar spine as well as the sacrum, if they break down in their mechanics as far as how they're moving, the efficiency of that movement, when that process breaks down, you'll get irritation to, again, those nerve roots in the lower lumbar spine that form the sciatic nerve that will then result in that pain. So that's really how we help with it, is really assessing the movement pattern of the individual, as well as their posture and then the mechanics of their spine. Again, doing that mainly through x-ray if it's warranted, but that's really how we determine if there's a breakdown in the mechanics and if it's impinging upon that sciatic nerve, and how we can best help them, and then come up with a plan from there, because everybody's different. The way they're experiencing sciatica may be different because of herniation or degeneration, or, like I said, most commonly that breakdown in mechanics. So if you know somebody who's suffering from that sciatic nerve pain, we'd love to help them out. Reach out to us, leave a comment in the comment section here below, or reach out to us at our website, or give us a call, 952-423-5050. Otherwise, if you have any comments or questions, just let us know, and we will talk to you very soon. Thanks, guys.